Welcome back to Open Line. Talking about healthcare in Tennessee. A lot of rural hospitals are closing. A lot of people are uninsured. We have with us Chris Coleman. He's a staff attorney with Tennessee Justice Center. And getting some interesting calls. I think it's a fascinating topic. It affects so many people, and it's good to hear how it's impacting people out there. Let's go to Ray. Hello, Ray.
Yeah.
Go right ahead.
I got a question for him, and see if he don't think this makes sense. If we, they say they don't have enough money to fund health care, is the reason they don't give everybody free health care like these other countries do, like Canada and stuff like that. These companies that pay the insurance on their employees deduct that from their taxes. And personal people that have got their own business can take off their health insurance on their employees from their taxes and stuff. If we had free health care throughout the United States, it would make these companies, big corporations and companies, pay more money because they would not be able to deduct that cost from their income. So they would be naturally paying more into the system. And then all the government employees that the taxpayers are paying for their insurance, to have insurance, would have insurance because it was a right. It would be an eligible right for every person in the United States to have health care if they need it. And I'm talking about health care now. You can't go get a facelift, but if you have a heart attack, it's going to cover it all completely.
Right.
And it would pay for itself because the companies wouldn't deduct it. They wouldn't have to deduct it. Everybody, and the people that are soldiers that got the hospital over at Murfreesboro and different places like that, they could go to any doctor and get health care. They wouldn't have to go back to the veterans to get their health care.
All right, well,
it would save money and make money in the long run, and these hospitals that are closing, if the government wanted to subsidize those then with the extra money, could keep the hospitals from closing.
All right, well, let's talk about that. Let's talk about that. I'm interested in that theory. Is that right? Companies can deduct their health insurance costs from taxes, and if everyone had access to health care, they wouldn't be able to deduct that. It could pay for it. That you heard what he said. What do you think of what he's saying there?
Well, I mean, I think there's a couple of related points. Yes, the amount that employers pay their employees, if they also provide health insurance, that money is not taxed in the same way if your salary would be taxed. So if there were some, let's say, Medicaid expansion or Medicare for all or anything like that, the company wouldn't have to pay that. They could raise wages instead of having to pay for health insurance. So if the United States is very unique in that insurance is locked to employment in the way that we have it here. This is a relic of World War II, where there were wage freezes, and so companies started offering health insurance as a benefit that became tax exempt. So they can give you more without that being taxed. The biggest problem with employer-sponsored health insurance, though, is a phenomenon known as job lock. People can't leave their job. They're at the mercy of their bosses because that's the only access to health insurance they have. So I'm sure there are entrepreneurs who have a great idea and really want to start a business, but they've had a precancerous condition and they know they have to keep health insurance, and there's no way for them to get it elsewhere. The biggest boon for small businesses in the state would be Medicaid expansion, because then they wouldn't have to worry about providing health care anymore. That would be something totally separate from employment. People would be able to move more freely between jobs because that job would not be tied, their health insurance would not be tied to that job. It would raise wages. any number of economic reasons for expanded access to government-sponsored health insurance that are pro-small business, pro-entrepreneurship, but again, our legislators don't seem to care about it.
What he's saying is, would small businesses be opposed, or businesses in general, let's say big businesses, would they be opposed to universal health care because of the tax write-off they currently get, or are you saying they would benefit from it?
Certainly small businesses would benefit from it. Large businesses, I mean, the market is too complicated to really know exactly where that would fall. There is certainly, there are business leaders who think something like Medicare for All would be a great for American business, because again, just getting that off their books, letting them focus on what they do, producing products or ideas, paying their employees, that would be the focus, not dealing with insurance companies and trying to provide all this. It seems like a no-brainer that we would just separate these functions out. And there have been studies, a study by the Mercatus Institute, a libertarian think tank, that said overall healthcare spending in the United States would actually decrease with Medicare for All, because you don't have insurance companies sucking up the excess there. They really are like ticks on the system, just sucking out profits that we don't need to be paying. If we just had a system in which there were people had health insurance, there were doctors, and there was a single system in between them, just like we have Medicare. People love Medicare. Why don't we want it for more people? I just don't get it.
They're just powerful groups that are scared of change, or that don't want change. I don't know if they're scared or they just actively don't want. I mean, they're doing all right now. Why change anything? Is that what's happening in some? I mean, it seems like the status quo isn't perfect for a lot of these groups, but they're scared of what it might change to, so they just fight everything.
Well, I mean, the insurance industry, of course, is fighting it because Medicare for All would make them obsolete. We wouldn't need insurance companies anymore. Maybe some small supplemental plans, if you need dental or something like that, but ideally a Medicare for All would cover that. So,
and insurance companies have major money. Yeah. They're a huge lobby.
Right, and I mean, they're the number one thing standing in the way of making sure that all American citizens have health insurance through Medicare, which would be a simpler system, less administrative complexity, less problems for providers who have to bill multiple companies at different rates. There would just be a single payer. And it seems like,
again, that is so political, these words. Then people start talking about, are we socialist, and all of these things. So how do we get past some of that?
Well, I mean, I think we already have Medicare. It's already here. The socialist, all these terms are meaningless ultimately. The question is, what policy option makes sense? What would actually improve the lives of Americans? In Tennessee, Medicaid expansion is a no-brainer. It makes absolute sense, and there are no good arguments against it. I've never heard a good argument against it. Oh, it's going to cost too much? Well, the hospitals say they're going to pay for it. This is mostly federal funding. It would keep our hospitals open. There's just, it's purely ideology and politics. It's a hatred of Obama, and this belief that people who are unable to get health insurance somehow deserve that because it's somehow a moral failing on their part.
All right, we have to take a break. We'll come back, continue the discussion. Take a break. Be back right after this.